I'm not going to give you now the handout. I'm going to do it after, so you could really quite listen to a new technique. And the technique has 3 names. Each name would say that each name would describe the technique a little bit different, and the use of it would be a little bit different. But the technique name is vibration, shaking, or rocking. So vibration, yeah, shaking, or rocking. So it's all about movement. Yes, hopefully not too much. Yeah. So it is really a group of technique, and you can call it by the name. Now I do vibration, which is quite similar to friction. Do you remember? Mm-hmm. The difference is in vibration, you're staying on the same place of the body. You're not moving on the skin. So this is friction. This is vibration. Again, friction, vibration. Okay. The other one is shaking. When you're, it's a little bit slower and more deeper. And then the last one is rocking, that is a lot slower, yeah, and it actually can be quite relaxing. Okay? Each of the technique you need to have a different speed. Okay, so what do you think the effect of vibration? Is it relaxing or stimulating?
Stimulating.
Stimulating, right. But if I'll do it light over a long time, it can be quite relaxing. So sometimes it depends on your quality. If you do that quite strong, yeah, it's stimulating. So can you give me 3 clients, 3 situations in which you'd like to use this technique, stimulating technique? Athletes, yes, before maybe the workout or race, yeah?
In the morning, for someone who has massage in the morning.
Yeah, someone in the morning, maybe they want to relax, and then at the end of the treatment you want to sort of get them ready for work.
If they're going to work, yeah.
Yeah.
Someone who doesn't really move much during the day at work, sitting down all day.
Well, yeah, at work, or thinking someone who even didn't do a lot of work for a long term, maybe injury. Yeah. Imagine someone had a fracture somewhere and they didn't use it. So it would be like a nice wake up to that area. Yeah, vibration. Yeah. Right. So where can you do vibration? You can do on the shoulder.
On the gluteus.
On the gluteus. Yeah. So it's quite difficult at the beginning because you're thinking, where do I take this vibration from? Almost like your whole body needs to vibrate to do that. So start slow and then move a bit quicker. Now, I don't tend to do that technique a lot, and I don't think that many therapists would do that. They would do that mostly after injury or when you need to sort of wake up the client. They need to work, so they want to have like an on-site massage quickly and feel a bit better after that.
Cool.
Yes.
Would you use it on somebody who has MS or something, who doesn't have so much
That's a good example.
In the
That's a good example, because in MS you may have a lack of sensation because some part of the brain been inflamed really. Yeah? So you have inflammation of brain, you can't feel it. The risk is that you're not going to feel it and you do more. But the benefit of that, they actually, you start saying, okay, brain, start talking to that area. Do you see what happened? Yeah. So I would say that if you are careful enough, it will be better. It will be beneficial. That that part of the brain does not activate well that part of the body. You need to wake it up. And sometimes you can see the improvement. I mean, there are more active use of technique that happens exactly after stroke or after MS, in which part of the brain either not working well or dying, then you can, by using that area again, create a different pathway of nerves to that part of the body. Yeah? So Next one is shaking. So vibration is quite small. Now I wouldn't say that there would be a lot of difference, but shaking you can go deeper. Yeah? Here on the gluteal area. Yeah? On the leg. Again, stimulating or relaxing? Stimulating more, but you could see that if you do it quite slow and nicely, then after a long time, it's like a lullaby, you know? Babies, how you send them to sleep. You do a bit of rocking and then... So we tend to not grow from that much. Yeah? The one I like most is the rocking, because that I would say is quite relaxing. Now, where do I use it? Imagine you have a client really stiff. You're working on them and you feel, my God, you know, everything that I do is like deflected away from the body. The muscles still stay the same. They're like that. They're lying this way. Yeah? So if you start moving them, can you stiffen yourself and make it hard? Yeah, exactly. And you feel it doesn't move. So actually you start to exhaust them now. You start moving and slowly they're just feeling, okay, I have to let go. Because I can't stay like that. It's you actually bring a mirror to them, to their body. And that is, at the beginning they might not even feel it, but slowly you would say they would relax. Another example would be in the legs. Yeah? If they have a very tight legs, at times it would be actually as tight as that you can't move it. So you do the movement to give the brain feedback and the brain to recognize that actually you can't spend so much energy holding it. You have to start let go. Yeah? So the body would let go. And there would be really people, clients that they are there, and you would have to fight them to do it. But don't worry, if you do the massage, it's not any better because it's not going to do anything. You know, you're trying effleurage, petrissage, compression, nothing works. Just that technique would work. Yeah? So you can do it here, you can do it on the leg, you can do it actually coming into this area, you can do it this way when you're sweating a little bit backward. Yeah? Or you can push the heels forward, or you can do one leg at a time. Yeah. It's quite, you know, you're just playing trick on the nervous system. Yeah, you just give the nervous system a mirror to say, that's your situation right now. So, yeah. Even you can do a bit of, this would be more of a percussion, yeah? Yeah. So you see that his body does not move. This would be vibration. That would be rocking. Yeah? You can take it even further. You can do rocking, sorry, I would be in massage. You can do rocking this way. Yeah? Now why is it? Some people, when you move their leg, they help you. So hold it there. So you can do that, and they will keep talking to you, and you would start doing the massage here, and the leg is still here. Yes? Why is it? What's going on? Why don't they drop it? They don't relax. And their body does not recognize it. So in a way, you're saying, okay, well, let's fight it. And they start to fight it. And you start maybe slow and little. Yeah? And then, yeah, relax even further now. Good. Until you actually, and it can be quite exhausting for them and hard. Yeah? So you need to be sure you can maybe start doing it like that. Yeah? That's a lot easier because it's a smaller movement. Yeah? So another shaking, yeah, or lifting a little bit.
Really?
Yeah. Yeah.
What does that feel like, Lucas?
That's really funny.
It's really fine.
Funny.
Oh, funny.
Oh.
Yeah.
That's
Okay.
very nice.
So starting with that, yeah, going on to the hip, yeah. A lot of people, you don't feel comfortable working on the hip, you know, and they don't feel comfortable. So you avoid it. Don't start, and then you're working on the hip this way. Yeah, with a bit of rocking. You can do a light rocking that way. Yeah. The one I really like are the rib cage. So one hand here, one hand the other way. I'm on the ribs itself and working up and down the rib cage. You can do that.
Use it over the towel all the time.
A lot of the time over the towel, because if I oil it, it's a lot easier. I don't want to glide on that. Yeah. So that's another great technique, you know.
Would you do this before you actually start the massage?
As needed, really.
you
So
can just-
usually I would use it in the middle because it would be like a different assessment. If it would be like a client that's really hard to move, then I will do that. Come and turn around, please. Put your legs up. Good. How about doing that technique over here? Taking your legs, coming here. Yeah.
You happy, Lucas?
Mhm.
Yeah. Good. Or leg by leg.
She's taking a picture of his face.
Yeah. Now, do you see his head nodding? Yeah. That means that actually the movement goes through his body. You would see some other client that actually doesn't move. This movement does not pass through them. They're stopping it. Yeah. You can lean. Yeah. The same way. You can move it that way.
But you can help muscle and plus you can help joints to move
Yeah.
it. Yeah, that's like more.
Yeah, you can actually do a little petrissage while you're doing it. Yeah, good. You can do with the arm. Yeah. You will not believe how many people you take their arms and hold it there, and it will be there. And then you can do other technique, and then they're like frozen hello. Again, the same problem. Yeah. So even try to drop it. Try to let them feel the weight. And it's quite hard when you're in your mind and not connected to the body. You know, as a whole, we try to connect them to the body, to feel it. And to feel when they have tension, so they know where to stop it. And not before it's terrible. Yeah, good. One last thing I want to show you is that you can do it on the head even. Very small movement. Yeah? So you're just lightly touching and moving side to side. Now, how does it feel?
Yeah, it was great.
Yeah, it feels crazy. It feels like the beginning, and if the client doesn't like it, stop right away. It's not for all, but it can be quite relaxing and nice. Yeah, and again, other rocking you can do on the ribs. Yeah, I use quite a lot of rocking because it's really helping and relaxing. Yeah. So again, not for all. Probably if you have a client that is very rigid and you feel that massage doesn't go into them, then you have to do that. The rest is more as a stimulating technique, and if you do it longer time, it can be quite relaxing also. Shall we, any question before? So I would suggest even for the practicality, just take your shoes off, stay with clothes and practice it. It will be quite quicker. Okay? Facing down, facing up, I'll come around and help you with. Yeah?
Yes, please.